Facing the highest number of hospitalizations during the pandemic, the FDA's acting commissioner appealing to keep the focus on essential services.
Most people are going to get COVID. All right, and what we need to do is make sure the hospitals can still function.
The most seriously ill are the unvaccinated, but there are no clear answers yet for how quickly we could see vaccines for children under 5. Those clinical trials are still ongoing.
We are working very closely with the manufacturers of the vaccines on accelerating and making sure that vaccines are available for the youngest children.
Hospitalizations for children are also at an all-time high. The CDC says the risk of hospitalization is now 17 times higher for unvaccinated people than for fully vaccinated people.
It's not only the fact that hospital beds are being taken up by COVID-positive patients, displacing the heart attacks and the strokes and the appendicitis cases, etc. But also, this virus is spreading so fast that we have a lot of medical staff out.
Harris County, Texas, going to its highest COVID threat level for the third time since the pandemic began, while the state plans to deploy another 2,700 medical workers to assist with the surge. The strain on hospital beds triggering a limited state of emergency in Virginia. The National Guard now pitching in Kentucky.
Not only are you distorting it.
Dr. Fauci calling out Kentucky Senator Rand Paul today for raising money by repeating false claims, emphasizing the danger in that.
That kindles the crazies out there, and I have life threats upon my life, harassment of my family and my children with obscene phone calls because people are lying about me.
And as the debate over vaccine mandates makes its way through the Supreme Court, United Airlines reports their mandate has been a success in the Ómicron surge. Prior to our vaccine requirement, tragically more than one United employee on average per week was dying from COVID, but we've now gone 8 straight weeks with 0 COVID-related deaths among our vaccinated employees. Amid the Ómicron surge, the Red Cross is now reporting the biggest blood crisis shortage they've seen in a decade. They are citing COVID cases, staffing shortages, cancellation of clinics, even the weather as reasons for the shortage. They say doctors are being forced to make decisions about which patients get transfusions and which patients have to wait. In New York, Alexandra Field, CNN.